The Presidential Health Compact is a framework for fixing the South African health system to ensure NHI delivers equal and high-quality free health services at point of care. This Thursday, we'll see the third iteration of this ongoing effort to reach universal health coverage. We're joined now by Dr. Olive Shisana, who's a special advisor to the President on the upcoming Health Compact. A very good evening to you. Thank you so much for your time. Talk to us about what is set to happen as this gets underway.
Let me say, first of all, good evening to you as well as to the listeners. As far as we're concerned, what we're trying to do with the Health Compact is really to accelerate the health system strengthening and national health insurance implementation. We want to make sure that the health services are fit for purpose insofar as the national health insurance is concerned. We brought together various stakeholders from the labor, the private sector, civil society, health professionals, traditional leaders, traditional healers. We all brought them together to say, what can we do to improve the healthcare system? People have been complaining during the public hearings that the health systems need to improve. And we have been working tirelessly with all of the stakeholders, with the Department of Health, to ensure that we improve the healthcare system so that it can be able to deliver what it needs in terms of the national health insurance.
We know that 9 healthcare professional bodies representing more than 25,000 healthcare practitioners have said repeatedly that they will not sign the President's Health Compact on the grounds that it's nothing more than an attempt to lock in support for the National Health Insurance Act. As you speak about the various stakeholders that you've brought in, what role are you hoping they will serve as this gets underway?
Let me first say that I'm actually surprised that the health professions are saying that they will not be able to participate in this, because they were part of the first Presidential Health Compact, which happened from 2019 up to 2023. They had been working towards improvement of the healthcare system. The compact that is being launched had their contribution. They knew right from the beginning that it was a preparation for national health insurance. In fact, during the day that we were, putting out a pledge, we're signing up to a pledge, there was one item, number 10, which said, and everybody was singing this, actively support the National Health Insurance Bill and foster a culture of accountability as a rational means of attaining universal health coverage in South Africa. There was no objection. They were singing that with everybody. Suddenly, they've changed their tune. And they were also friends of the NHI in 2019 when Minister Mkhize called them to launch the NHI bill when it was going to Parliament. Then they complained, they said, well, the bill hasn't changed much. Well, it didn't change much because they supported it. They were the friends, they were happy with it. And now that it has been passed by Parliament, now we hear a different tune. That's where we get
to my
confused.
understanding, the professional bodies say the compact is fundamentally biased, and that they're saying that it has been drafted in a way that now solidifies support for the NHI Act as the sole solution for achieving universal health coverage. I mean, that in itself is something to perhaps take note of as you talk about their input and where the bone of contention could possibly be.
Well, that's why I'm worried about it, because what is written in there comes directly from the summit, where we had more than 1,400 people who were talking at that particular meeting. And the theme of that particular summit was actually including the question of national health insurance. So I'm not understanding what they mean when they say it is biased towards national health insurance, because throughout all of the discussions that we've had, we've always focused on preparing the healthcare system for the implementation of national health insurance. So I'm confused myself as to why that is the case.
As you meet,
why did they change their mind?
Yeah, I suppose it will be important to get the answers to those questions when you meet. You speak about various stakeholders coming to this discussion. What are you hoping to get out of it? What sort of clarity and direction do you want it to take?
Well, I want to say that of the 230 stakeholders, represented in the group that we're working on, we know that about 2 groups are the ones that say that they do not want to be part of the compact. Our view is that the majority of people in a democratic society have decided that they want to support NHI. We therefore expect that they are all going to work together and make sure that the quality of the health system has improved tremendously, that the facilities are well refurbished and they pass the standards that are set up by the Office of Health Standard Compliance, and that access to medicines is much easier, that medical records will be available in any part of the country when NHI is implemented, so that you can be able to be seen immediately by the doctors with your record of information that was obtained in another facility, and also that will be able to reduce the medical legal claims, which are the corruption that is actually taking place, mainly because there are lawyers that are actually claiming that certain conditions exist when actually they do not exist. So we're hoping that we'll be able to work together with them to the benefit of the public. But with regard to those that are refusing, the door is always open for a discussion. We are all looking forward to having them in our quarterly meetings, where they will be able to come and engage. They should look at the document itself. It's exactly what it is that they had discussed and agreed upon. And now they are turning around and saying, no, we are not interested in signing. It's okay, but on the other hand, we must remember that the health professions groups are a diverse group. Not all of them are against signing on the compact. It's not true that that is the case. You'll see it on Thursday when the signing takes place. You'll definitely see it.
Okay, well, we will be keeping a close eye on it, and it would be interesting to speak to both sides, those who are for and those who are opposed, to get a sense of the direction. But we will be looking out to see what happens on Thursday. Hopefully, perhaps you and I can continue this discussion after then. Dr. Olive Shisana, thank you so much for your time. She's the Special Advisor to the President on the upcoming Health Compact.